You saw the difference when the border was closed. And then you had a new problem, everyone else getting sick. And I remember at the time, it did not feel like a normal virus. I had
Yeah,
questions about it with regards to where it came from.
yeah,
Um, People telling me, well, there's cases in France, and I'm like, I'm not talking about France. And whenever I was questioning it, as somebody who was seeing it and taking
yeah.
care of it, one of the first batches of nurses in the United States, mind you, I'm called I would call the racist for it. Hello, folks. I'm Nurse Dad, former Navy hospital corpsman and current ER nurse, and welcome to my channel, which is clearly not in my studio. It's one of those mornings, kind of busy, so I figured, hey, it's sunrise. Why not take the camera and the mic, go outside, and shoot the intro to this video. I'm pretty proud of the interview you're about to see. It's between myself and Nurse Gilanie, aka Citizen Nurse on Instagram. By trade, she's an oncology nurse outside of LA, a nurse manager, and she was gracious enough to sit down with me and have a virtual interview about nursing. Her passion is civics. And what is civics? Civics is basically nurses getting involved with what nurses do. Nurses getting involved not just in the rules that allow them to become better patient advocates and better nurses, but being a part of the creation of laws. This could be at the local level, the state level, and the federal level. Now, I won't say trigger warning because this is a democracy-loving channel, and you really can't participate in a democracy, let alone civics, if you refuse to have a conversation or if elements of a conversation trigger you to the point where you have to leave the room. But I will say, in the old school, disclaimer. Our conversation isn't about the COVID-19 pandemic, certainly not about that first year of uncertainty, but it does touch upon it. And it touches upon it from people who were there taking care of patients and saw some crazy stuff. I just lost my sunlight. God, if you love this channel, please bring back the light. Huh? How about that? Ask and you shall receive. But before I lose the light, let me finish. This interview ranks up there with one of the most favorite on my channel, and I hope you enjoy it. So without further ado, let's kick this pig. I know your mission as a nurse, or your focus is civics, but just
Yeah.
tell us a little bit about your background.
My name is Jelani. I go by the handle of Citizen Nurse. And my background actually is oncology. Been in clinical nursing for over 2 decades and definitely not into politics, not into civics or anything like that. I mean, you go into nursing to be a nurse, not to be a political science person. Um, but I started getting interested in civics and advocacy around the time of the pandemic, just because I really understood at that time, like it really dawned on me how integrated what the government does and government policies are to how we practice as nurses. And at the time, I was a nursing supervisor, and I felt like I was in the middle of what was happening on the front line and what the hospital policies, which I discovered later on, are truly like, based in government policies, how our patient care is really affected by that whole relationship. And so I had a bit of a crisis, a personal crisis, I think, as a nursing supervisor, because I'm like, okay, I know what should be done as a nurse,
Mhm.
but there are limitations on what I'm being told what we can do. So then, just going through that, like, a professional, personal crisis, it really set me off on this journey to find out, okay, why do nurses not have enough power or say so in health policy? What can we do? And I mean, it took a couple of years. That was 2020. Now it's 2025, 20, just starting 2025, right?
Really, it was
Um,
last week.
yeah, that's right. So, my mission wasn't really like, oh, I want to talk about ethics, I want to talk about advocacy. It was really like trying to find ways to empower nursing and, what I could do as a nursing leader at that time to make sure my staff was safe so that they can practice safe patient care. And when you start looking at things like that, I think your mission starts aligning with other nurses and, people in healthcare who kind of see that connection. So I started meeting some really amazing people. I joined some great nursing organizations where they knew like the importance of um, nursing advocacy or health policy and what voice nursing could lead to that. But then I also started seeing that there aren't enough nurses that know that civics is important, that, what the government does really affects how we practice. When you start seeing the ways that the nursing profession can be empowered or start seeing the ways of the difference we can make. You just don't want to stop there. I mean, like you have this wonderful message, this wonderful, I call it like the Wizard of Oz moment, that I had where I found out like, I thought the government had us, or and like, someone's going to take care of us, the government, the
Yeah.
hospitals, CEC, federal agency, somebody. And then when I started digging, you peel back that curtain and you're like, oh no, nobody really is in charge of what nurses are doing, or not in the way that we thought it was. So then I thought, we don't want to trust people that don't know anything about nursing or about how we practice to make decisions for us. Like we have to really claim that decision making for ourselves, educate ourselves, and inspire each other to show how important this journey is. So that was like my Wizard of Oz moment, and what keeps me going. There's like millions of us, millions and millions of us in the United States, and we are on the front line saving lives every day. It's not just an obligation to our profession, but also an obligation to our patients to make sure that we are leading how we practice and making being part of those important decision-making processes so that, like when it comes to care for our family or for us, that we're getting the best possible care as possible.
Yeah, it's what you had said to me, and I'm reading my notes so I can get it right. If
Yeah,
you don't have
yeah,
a seat at the table, you're probably on the menu.
that's right.
Um,
That's right.
you and I went through it. We'll just leave it at that during COVID, I believe.
Yeah,
2020, I was a staff member in an emergency department in Queens. I was the night shift. We were a sixth-floor hospital, but we're also in Queens, so we have a 100-bed emergency department. And I go in there, and 8 nurses coming on duty. We have 108 patients and 4 ambulances coming every 15 minutes. And I had to get report, and I used the word report with a little r because it wasn't very efficient. I got report on 24, 25 people. That's when I became a travel nurse 2 years after that. Actually, I endured it for 2 years. I got
yeah,
so burnt out. You did feel like you were kind of working for multiple organizations. There was the federal government
yeah,
side, there was
yeah,
the hospital side, there was the state. New information like, oh, it's airborne. You're like, well, how airborne is
yeah,
it? If I walk through
yeah,
it, do I have it?
yeah,
Is it like
yeah,
tuberculosis, or is it worse? Like nobody really
yeah.
knew what was going on. And as
Mhm.
far as the political side, yeah, that came into play a lot. That you
Mhm.
realize with civics that politics is inevitable, but from how I go about it is I can't pick one side or the other when it comes to patient
Yeah,
care. I've taken care of people who have murdered. What are you going to do? You're
yeah,
going to judge the person and shape your care
yeah,
around that? Well, one, if you get
yeah,
caught, your license is gone.
yeah,
It's not
yeah.
authorized.
We have our code of ethics, definitely. We have our code of ethics, and that's
Yeah.
what makes us a profession, right? As we have these ethics that bind us and that guide us. And I don't approach it from one political side or another as well. When it comes to healthcare, I don't think anybody is going to disagree on quality healthcare. Like everybody wants that. Doesn't matter what your political affiliation is. And our obligation, I believe, as nurses, is to be there and to provide the healthcare and that human dignity that that person deserves. And you mentioned you were in Queens, right? Like when the pandemic started. So I'm
Yeah.
out here in
Which hit very
California.
hard.
Yeah, very, very hard. And so I think being on the coasts like we are, right? We see a lot of things
You were in
maybe
LA,
that
right?
hit, yeah, and yeah,
Yeah,
outside of LA, yeah. So
outside
I
LA.
mean, we see a lot of things hit us that may not affect like the middle of the country as much, right? But I remember seeing what was happening in New York, especially like, the people that were getting sick and dying, and then starting seeing what was coming like down San Francisco, down California here. And I've been in healthcare a long time, and you kind of pay attention to what's going on, but you're more like focused on like where you're working at that moment. But I mean, something big enough was happening where you're like, oh shoot, like this is going to be big, like, and nobody has the answers to this, and you're just doing the best you can in that moment, right? So,
I feel like it got
um,
ugly. I feel like it got ugly at that time
yeah.
because I remember the biggest issue we had for the first 2 weeks was we didn't have enough translators. It
Hmm.
it it seemed like people from outside the United States who had a way to get here were coming here, and nobody spoke English. Not that it's expected to, but when the majority don't, and you have three virtual translators, maybe two that are
Yeah.
actually working,
Yeah.
how can we get the information? And you saw the difference when the border was closed. And then you had a new problem, everyone else getting sick. And I remember at the time, it did not feel like a normal virus. I had
Yeah.
questions about it.
Hmm.
And for my questions, like with regards to where it came from,
Yeah.
um, people telling me, well, there's cases in France. And I'm like, I'm not talking about France. And whenever I was questioning it as somebody who was seeing it and taking
Yeah.
care of it. One of the first batches of nurses in the United States, mind you, I'm called I would call the racist for it. It really got ugly like that because
Yeah.
you're seeing what you're seeing. It did not feel like a normal, I never seen anything like it
Yeah.
before. It was
Yeah.
like if you had any kind of ailment, if you were prone to asthma, well, it attacked your respiratory system. If you were
Yeah.
prone to heart issues, then it attacked your heart. Then you start getting information about what it looks like under a microscope, that it has a sort of
Yeah.
hook that is artificial. I'm not
Yeah.
saying I'm not saying like what I believe it is or what it is not, but even to
Yeah.
talk about it, you felt like you were getting attacked. And then
Yeah.
you read about the people at the time, the
Yeah.
scientists that we were referring to. You read that they can get um, financial incentives that they don't have to declare, and they're not taxed on. And you're
Yeah.
wondering like, what does that have to do with their decision making? And it's just that you're trying to get involved or ahead of it.
Yeah.
And from your own community, there seems to be a like, bow your head and do what you're told. And you're like, well, that's not what nursing is. There's also
Yeah.
the other side of the aisle. I would be treating a lot. I've had 4 or 5 people die on one shift at the time, and then I go home and on Facebook, people are saying that COVID doesn't exist. So
Yeah.
there's that side of the
Yeah.
aisle, and it was like
Yeah.
it was the first time as a nurse that I felt like, wow, politics just jumped right into this thing. Like you can't
Mhm.
say one thing without being associated to that group. You can't say another thing without being associated to this group. This group, I've had people in the ER at the time, like a year later, let's say, trying to give like a COVID swab, and someone screaming to me, and "You're trying to put a microchip in my nose." It's like,
Oh yeah, I
you
remember
know,
this.
um,
I remember those days. Yeah.
yeah. So COVID,
Yeah.
we could go on and on about the COVID period, but just yeah, that made me really focused on who's saying what, where is it coming from, and why can't nurses speak their mind and reflect on what they're seeing and ask questions? And because you
Yeah.
can't even talk about civics unless that's a possibility.
Mhm.
Like you were saying, it is amazing how many decisions come down the pike by people who wear suits and don't wear scrubs. It just felt wrong at the time because you saw the
Mhm.
patient suffering. You saw people
That's
coming
right.
You saw
Yeah.
people coming from here in New York. We had a big problem with the patients coming in from the nursing homes. They'd come in for almost with like nothing wrong with them, but the policy at the time was if they catch COVID, they can't go back. And what happens when you send a 78-year-old person to an emergency department that is basically the entire thing is an isolation room? They're probably going to get sick, and they're probably going to have to stay. So
Mm.
that was just a touch of my COVID experience, and
Yeah. Yeah.
that's why I want to get involved, and
Yeah,
that's what
you,
kind of what
you said it right. I mean, you said it beautifully. There's a bunch of people in suits
I
that
don't
have
know. I
never
wouldn't say
been in
beautifully.
scrubs.
You say things
No,
beautifully. I just kind of spit them out. But
well, I have a gut feeling, and this is kind of what drives my mission. I have a gut feeling that if nurses were part of the decision-making process at the time when COVID just was like kicking off, it wouldn't have
mm,
been as bad as we saw it. The
no, it wouldn't
reason
have. And you
being
know what?
is,
That's what I wanted to say. But you said it
yeah.
because you're a better orator than I am.
No, but I mean, that's what I feel like because not only do we see the science, but we are there with the patients and families. So when you're humanizing, like, whatever statistics, data, all that stuff, you have that extra something where you're like, I got to do more. Like, there's more that needs to be done, not just like, hey,
Mhm.
here's a policy, roll it out. Like, we are the perfect link, I think, between the science and the numbers and what's actually happening, in people's lives. So that's why nursing is so important. That's why um uh I don't think nursing has to be political, but you have to be
No, of
accepting of the fact that politics does influence nursing. It's just basically knowing the rules. You have to know the rules. These things happen. That's the reality of
course.
life. So how can we influence it? How can we, try to control it if it should be controlled? But I mean, for a nurse to like kind of stick your head in the sand and say, "Oh no, politics has nothing to do with nursing. Nursing is nursing," and you know, government is government. No, I don't think you're going to get far with that mentality. I mean, really, my ask for nurses, you don't have to run for office, you don't have to do these big
No,
things. My ask is just know that there is a relationship between the government and how we practice. And what you do
yes.
with that information, it's truly up to you. But like, don't think that we're practicing in a like a silo and nobody can like touch us other than the CNO or CEO. Like, they're
Yeah.
they're mandated by lots of things too. If the pandemic didn't happen, think about like Medicare, right? Like government insurance. You were in the service, right? So like you've seen how healthcare rolls down, like if you're in the military.
I see what
But
happens when the government runs it. I tell you that.
and like things like JACO, right? Like the Joint
Mhm.
Commission, like that may not be like fully from the government, but there are things that are regulated by the government that affect healthcare. So even if the pandemic never happened, there are government agencies that directly influence how we practice as nurses. And there's a federal level, and then think about in your state, like, you got the Board of Registered Nursing. They may not be, depending on your board, they may not be like part of the government, but they definitely regulate how we practice. So, um, it's important to know that there are things outside of the hospital walls that really affect what we do.
People aren't gonna get involved if they feel like they're gonna get personally attacked by others
Yeah,
for having a different opinion, especially
yeah,
if it's very frustrating if your opinion is based on your expertise, and then somebody
yeah,
not even in patient care, you
yeah,
know, is attacking you over it.
yeah,
Most people just want to go to work and take care of their families. They're not looking
yeah,
to be a crusader.
exactly.
Hello, folks. I hope you're enjoying the interview. Before we go back, let me announce I wrote a children's book, Isabel Learns to Share, a love letter from me to my firstborn daughter, Isabel. It's available on Amazon, but let me be clear. In a world of AI, this book is written by me, every word of it. Everything this book earns goes right to the podcast. This book emphasizes family values, respects parents, and respects children as they go through life making mistakes, but ultimately learning how to become their best selves. Click the link down below, support the podcast, and get yourself a copy. Thank you very much.
Exactly. Yeah.
You shouldn't feel like you're going to war. You shouldn't need a sword and a shield
Hmm.
to advocate for people based on what you're seeing and what you feel needs to happen.
Because we have this process. It's not just we're saying, oh, this is how I think healthcare can improve and just make it up. Like
Mhm.
we are grounded in that nursing process. We do follow a scientific method. And I think because the general public doesn't know really what nurses do outside of like the television.
Right. Of course. Yeah. I'm just looking at my notes. I'm listening
Yeah.
to you.
So when nurses have an opinion, it's not really taken maybe into account or taken seriously because it's like, well, why is a nurse saying something? Where truly, in fact, nurses should be saying more. I think
We're
we're
truly the bedside. I've said this
we
before.
are.
There's a reason
Yeah.
our computers are on wheels. And
Yes.
I've had patients receive word from a doc that as soon as they leave the room, they ask me, "What did he say?" I'm like, "Ask him. If you don't know, you don't understand what he's saying, ask him, or her." But
Yeah, yeah,
there's definitely a relationship that's very personal between the nurse and the patient.
absolutely. Yeah.
And I find that nurses are different in terms of how they view patients because they're very obsessed with their patients, very possessive of their
Yeah.
patients, and they're kind of expected to know it, like what cologne are they wearing because from leadership, like you really need to know everything about
Yeah.
that person, and now in real time, even if you got 12 patients or 10
Yeah.
patients or 8 patients, I know California has patient nurse patient ratios, not here. Um, which is actually something I want to take to DC one day. I think that should be, I think the law of the land should be
Yeah.
4-1
Yeah.
or 5-1.
Yeah.
When I was working in
Absolutely.
Queens, when I was
Yeah.
working in Queens before COVID, I can have anywhere. I had average 10 people, 10 patients in the emergency department. I did a contract and the cutoff was 8, and I thought I was the most spoiled nurse I have ever seen. I was like, 8? There's a cutoff? No more than 8?
Yeah.
Not
Yeah.
including, you're also on the trauma team or the rapid response for whatever's coming in through the door. You
Yeah.
might be
Yeah.
on the trauma side one day, you might be on the resuscitation
Yeah.
side.
Yeah.
Um, you might have an ICU patient in the code room that you have to sit on for, an hour and a half before they go
Yeah.
upstairs while you take care of
Yeah.
those 8 people or try to go figure
Yeah.
that one out.
Yeah.
Um,
Yeah.
but 8 people, I felt so spoiled.
Uh-huh. But yeah, and that's another thing. I mean, I'm glad you brought that up, like nursing
Well,
ratios.
and
Like
not to cut you
that's
off
not,
too, that
yeah,
kind of affects the civic aspect. Because if you're burnt out,
absolutely.
how the heck am I
Absolutely.
supposed to get involved now with policy? I can barely
Yeah.
walk
Yeah.
leaving work, and I got stuff to do at home because I'm a dad or you're a
Yeah.
mom or whatever, and
Yeah.
I'm
Yeah.
supposed to now be involved, go to the meetings, and that's difficult. It's very
It is
difficult.
difficult. It is difficult. And I am fully aware of this. I think I was in a point in my life,
Well, I
in
know
my
you are.
profession where I had a bandwidth to do this. I mean, like, if the situation was different, no, my focus would have been something else. And you being an ER nurse, or I have nurse practitioner friends or people in ICU. I mean, there are going to be ICU nurses. There are going to be and then pulmonary nurses. I am very aware of the fact that I am never going to be an ICU nurse.
No,
But what
I'm
I
not going to
can
be either.
do, but what I
I
can
like I like
do,
to change the rapidity,
yeah,
in and out. Well, not really in and out anymore,
yeah,
unfortunately. You'll get people in the emergency department for a couple of days now waiting for a bed,
that's
but
true. That's true. Yeah. But I mean, it's like, I think those nurses that have the the capability to advocate and speak. I mean, definitely, please be the voice for our profession because you got people doing very important work at the bedside, doing research, doing, those kinds of things, education, bringing nurses in through nursing school. But, there are enough of us, close to like 5, 6 million of us, where even if you had a small percentage of nurses to advocate on behalf of the profession, that's going to make a difference. So definitely what I do cannot, it's not a one person job. Like the more I can kind of just share my mission and share, why I think it's important, you inspire other people to do this and you got more of a voice. And you talked about going to Washington, D.C. and talking about ratios. And nobody's going to know what we do as nurses unless we're telling the stories.
That's
And
how
like
I
you
feel.
said, yeah, you have to just tell the stories. I mean, patients tell us stories all the time, and you
Yeah.
might
It's not
help.
griping. It's
No,
because, I feel like, not to cut you off, there's a lot of people online that just love to complain or
yeah,
accuse or burn things down. I feel I have an obligation to my profession and to the patients. That also
yeah,
doesn't mean that I don't have my share of questions and skepticism about where things are
yeah,
coming from. And but it's not to tear the thing down. It's not to just be negative. It's certain things have to be said. It seems like sometimes from like the leadership, there's this need to portray how things look in a certain way, and we're supposed to pretend that it's hunky dory, you know,
yeah,
like some conference was there, and we spoke at a conference, or we had a party, or we're here hosting this event, and like, isn't everything great, and you're such a great nurse, and you guys, this team is amazing. And yet at the same time, maybe that team consists of 6 nurses in a department that should have 15.
yeah,
But there's just pressure to, who's going to say something, who's
yeah,
going to
yeah,
single themselves out
yeah,
and actually voice maybe an issue. Like
yeah,
there's not enough people that work here to take care of the
yeah,
the load that we have. I've worked at places where nobody took a break, and it wasn't encouraged by leadership to take a break, even though you're going to lose an hour of pay anyway because you're supposed to take
yeah,
a break. And
yeah,
it was so poorly organized. Like, I work at a
yeah,
place now that's amazing. They have a float nurse staff that breaks everybody, and they give you your
yeah,
hour and your 2 15 minutes together. You get an hour and a half
yeah.
break, and it is amazing what they do.
Great.
I have not encountered that at many places. And you'll get your
Hmm.
break. Maybe a nurse will take over your section,
Hmm.
which again is kind of crazy because maybe that nurse has 10 patients and you have
Yeah,
8 or 9. And now she's watching, or he's watching yours and theirs. So of course you come back to work and nothing's done.
I know what you
Uh,
mean. Know what you
but
mean.
but again, there's this pressure, I think,
Hmm.
or this expectation that we're supposed to reflect our working environment a certain way, and it seems as though it's controlled by the lens of the higher ups.
Yeah,
It's
yeah.
what management wants it to look like, and
Hmm.
who's going to be the nurse to say something, to really
Hmm.
activate and go forward and say, you know, this and this and this isn't happening the way it should, or
Yeah,
I'm not getting my break like I should, or
yeah,
what I'm saying? Like, what do you think?
yeah.
Have you seen that where you are, or
Yeah, definitely. It's a challenge, right? Because it's like from coming from where we are, taking care of the patient, you know what it takes to practice safely. And for some institutions, you're not given those tools, right? But unless you're telling your higher ups what you need, they're just kind of going to keep the status quo. And like you said, who wants to risk their job, right? You got your family and all that stuff. You don't necessarily want to risk your job. But yeah,
the nurse
these,
managers, even the
yeah.
department heads, sometimes they don't have a lot that they can do either.
Hmm. Hmm. So
You
that's when
know,
I think you got to start looking, who do they report up to? And how can we get nurses on that level? Because for the
Mhm.
most part, like, I mean, just kind of going back, like, to how the government works, I think there's like two or three nurses in Congress. And so I'm like, well, then there's only three nurses that really understand how nursing works or how healthcare
Yeah.
works. And so when you're kind of distilling that into your institution, it's about education, right? So when you're asking a doctor for an order, like what is going to get that, depending on your relationship with that doctor, you kind of know how you're going to talk to them or how you're going to ask it to get that
Yeah.
order, right? So it's the same thing when you're talking to administration. If you're talking to a politician, is how are you going to frame your message so that you're heard? If you're coming and then attacking someone, they're not gonna
No,
really
no
kind of give
attacks.
you a
You
lot,
can't
right?
attack
Yeah,
somebody.
yeah, yeah. And then we have these skills. Like we talk to our patients, right? They're coming into the ER to you're walking into their room, and within like two minutes, you have that window to have them trust you, right? So
Hmm.
when you can apply that skill to talking with people who are like the higher ups or who are making the decisions and kind of be this credible voice, what you're going to say is going to start making a difference. It's not an instant thing. I mean, it's about building relationships and building credibility, but that's
Takes
how we
time
kind
too.
of,
It takes
it takes
time.
time. It takes time. I mean, like think of you as a new grad versus now how you build relationships with your patients, right? Like it's probably improved a lot because you've just through trial and error and dealing with all sorts of people, you know what works, what doesn't work. But I mean it's about having those like skills, right? Those soft skills, those people skills, but also pairing that with our critical thinking. Because no matter how you're going to talk to someone, you have like a goal in mind, like whether your goal is I got to give them the shot of Dilaudid, but how am I going to let them, how am I going to make them say it's okay for me to give it to them, right? So it's the same thing like with your hospital administration, like, hey, we need more nurses, but how can they understand that? So part of the conversation or part of the mission might be gathering data or talking to your fellow
Yeah.
nurses. And sometimes, the reality is if you've tried your best and there's no changes, then maybe that's not the place where you need to be. Because then it's like, if you're advocating for what you think is right for not just you and your fellow nurses, because whatever we advocate for ourselves, it rolls down to the patient, right? So when we do advocate for ourselves, we're truly advocating for our patients. So if you're in a place where they're not listening to how things should be improved, then, you know, that it really is kind of like a personal decision of how much you want to invest in fighting that fight. But kind of just educating and getting the message out there. Or, whether it's you yourself that's going to be like, hey, let me get into that C-suite and see what kind of changes I can
Yeah,
make.
but I was about to say that,
Yeah.
you may need to get that go up the ladder a little bit. But I
Um,
imagine there's a lot of pressures even at that level. For example, health insurance dictates a lot, right, of
yes.
what's possible in
Yes. Yeah.
in terms of hospital policy. I find that as a nurse, what keeps me grounded is comes from the military, the person to your left and to your right. When you're in the
Yeah.
military, you serve and protect the United States of America, but like that's an abstraction. That's like I can't see that. I can't go into a dangerous situation with that. You direct it to the people that you're actually with. It's
Yeah.
also what I like about nurses a lot. I feel like I'm kind of with military personnel because, and there's a lot of similarities because there's a purpose you have to fulfill. This isn't like just doing a regular job. I don't know how anyone could just maintain that attitude when you're encountering one human being after another. Many of whom it's the worst day of their life. You just develop that camaraderie with your fellow nurses, and it's
Yeah.
very touching. It keeps me grounded, certainly during COVID, because you were what it was almost charming in a way, as crazy as that sounds, because for me it was very familiar. Having everyone had that laser focus. There were moments during the height of the pandemic where if I felt like I was back in the military or back in a role that is beyond purpose, that we really are forging a new path, or we're at least in uncharted territory, which is dangerous but exciting and tragic. And it requires you to be the best possible version of yourself in order to be successful. Again, I don't think it would have felt the same if I wasn't with nurses during it.
Yeah.
Um,
Yeah. I reminded a friend of mine. I mean, it was a different situation. She's a nurse, but she did mention that, in times of crisis like this in COVID, or even, think about the hospital if you're in a code and you just need to do what has to be done. sometimes these barriers, whether they're like the policies, the laws, whatever, she called them like the BS barriers. Because
Yes.
sometimes they're just like some rules that are put there just because a rule needs to be there.
Yeah, it really needs to be done.
But but
Somebody got hired and they're like, "Let me.
yeah,
How do I make my mark?"
but when things hit the fan, I mean, you just got to do what you got to do. And, like, some of these barriers just kind of say, well, sorry, you have to screw this for a while. I got to do
Yeah.
like it needs to be done. So I think too, nurses, because we understand what it's like when those moments happen, we're constantly prioritizing in our mind of what needs to be done in this moment for this patient to survive, or we need to do right for this patient. We have the critical thinking. We're constantly prioritizing, reprioritizing, and having that laser focus in those moments. It's all part of our training. Like we have these skills that the general public basically doesn't really know about, but
No.
how powerful and how um, awesome like it would be to apply these skills in industries that may not have like to deal with patients directly, but will, can affect how we do it. Like, get some nurses in those insurance companies and start looking at some of these regulations and all of that.
Of course, there's a bottom line. They have to. The
Yeah.
places have to make money. If nurses are involved in policy and they know how patient care flows, there could be an equilibrium
Hmm.
reached between what is financially good for the company and what is good for the patient. Because I find that if you're just focused on the bottom line, you're probably going to wind up wasting a lot of money. You're talking about leadership and like how I just say that leadership, people like you, I'm sure working for you is amazing. And I'm fortunate right now to have an amazing leadership. And I'm in one of the biggest hospitals in Long Island right now. Excuse me. And it feels as busy as it gets, it feels easier than when I was working in one of the smallest hospitals in Long Island for a contract because of the leadership. I wrote this down like what bad leadership feels like. Bad leadership feels like this, that the ship is taking on water and there are more hands than anybody wants to admit trying to manage the leak than to sail the ship. That's what it feels like. And when you have leadership that are listening and are, again, prioritizing breaks. I mean, when I have that break, an hour and a half, um, I feel so refreshed when I get back. And I feel a little bit more loyal to the hospital. Not that I mean, I always do the best job that I can, but I try to go a little bit more because I just feel so taken care of. And I feel like I can engage if there was opportunity policy more, or that I have more stake in where I'm working.
Yeah.
And I think that's also important. Sometimes you might feel like a rag doll, and maybe that turns you off from getting involved. Were you in oncology in 2020 as you are
I
now, or
was, yes, I was. It was even more trying to think of the right word, but I guess like more harrowing being in oncology, I think, because um, our patient population, they're already
right?
immunocompromised, right? They're getting chemotherapy, bone marrow transplant. So when you're talking about this disease out there that there's no cure for, I mean, like, I was freaking out, like my coworkers, everybody's freaking out, like, how do we protect our patients? Because they have like no immune system and we don't have a cure for this. But and I always say not to get political or anything like that, but um, people have feelings about masks and all of that. But I have to say, we had very low infection rates because we already were teaching our patients, especially getting chemotherapy, to wear masks. So even before the pandemic, if you saw someone in a mask, you probably were like, well, they're getting chemotherapy or something, right? But we had low incidences of infections and outbreaks because our patients were like, we were teaching them from day one of their chemo, wash your hands, wear a mask, or avoid large crowds. What we were teaching people like during COVID. What was difficult is because we had the shortage, right? It was even difficult for the nurses to give chemotherapy in the way we're supposed to protect ourselves. Like, so when you give chemo, you're wearing masks, you're wearing goggles, you're wearing gowns, right? So you're protecting yourself from the chemo in case there's a spill. But when we had the PPE shortage, I mean, like I couldn't get my nurses like the supplies. So it's like just that feeling like how can I continue protecting them to do their job basically to save people's lives when you couldn't even get these supplies anymore. So there was so many things that were happening that people don't take into consideration when it comes to things like this.
We need more suits
Yeah,
to shadow nurses and see what we're seeing. Because,
yeah,
I always think of Carl Jung's The Undiscovered Self. It's basically just kind of warns you from becoming an overly statistical thinker. It's very easy to look at
yeah.
the numbers, but there's also individuals. It's again, it's very easy for somebody who's not on the floor to look at the numbers and look at the budgets and make a decision.
We got to be there in those places where these decisions are being made. Either we can educate ourselves so we're in that decision-making position, or, build these relationships with people at those levels so that they can understand like the challenges we're having. I was going to say voting and just being knowledgeable on issues is something that what makes us good citizens, right? Not you don't have to be a nurse to do this. You don't have to be like a certain person. You can just, when these elections come around, um, it's so important that you at least be familiar with the issues and the local issues in your community. Those are probably going to be the most important ones that you
Yes.
vote on because they're going to affect you sooner than, what's happening in Washington, D.C., right? They can affect your traffic laws, what's happening in school, on your Department of Health. I mean, some of those positions are elected. The people on the health department or in the school board, they're maybe not so connected to what's really happening out there. So, we as nurses, we can educate. We're subject matter experts. You don't need like a dozen certifications in nursing or a master's degree, doctorate degree. The fact that you have the RN after your name or LPN, LVN, you're a subject matter in nursing. And so you have a voice, like use that voice to educate, use that voice to share what stories you're hearing from your patients. And some of the stories you might hear is like, your patient can't afford their medication because of their insurance and blah, blah, blah. So, that might be an email that you write to your congressperson or your local lawmaker and saying, hey, like I take care of these patients and they can't afford their medications. Do you know that this is happening? Because I guarantee you, if you called up your the assembly member or your congressman right now, they probably have 12 other people that are trying to get their attention. So it's all
Right.
about being the loudest voice, just like you're trying to get that doctor
Consistency too, yeah.
yeah, yeah, you're trying to get that doctor to give you an order. And sometimes it's just, you gotta be, on that phone calling them, like and being annoying, just
Well,
so
you
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 can,
you touched on credentials,
yeah,
but once you're an RN, you are a subject matter expert because sometimes I feel like people are
absolutely.
stacking credentials, stacking degrees, and
Yeah.
that's great. You go back to school, you do that, but I find sometimes people they measure themselves too harshly against other
Hmm.
people. They discredit their own experiences and what they know. And I always I tell people, you're if you see something and you have knowledge on something and you believe it could be better, then speak up. Nurse Dad here. For you college students or novice nurses, I want to let you know that in the description below, there is a link for 2 free Nurse Dad guides. The first guide I designed for college students on how to better optimize your time so you can do the things that you want to do in life, but still try to go for that A. The second guide is for nurses specifically based on my life experiences as an ER nurse and in the military. Just a few tricks on how to multitask and not burn out in patient care. So whether for you or for someone you know, I hope you find these guides helpful. Thank you very much. Nurse Dad out. One of the things I appreciated with the Marine Corps as a Navy hospital corpsman was that their leadership comes from the middle. So yeah, you have officers and you have high-ranking enlisted, and then you have the lowest ranking enlisted, but their leadership historically comes from the sergeants, comes from the middle, because they're on the ground and they're in charge of the lower ranking guys that are not too far from them, but are like the lowest ranking
Yeah.
people. And the officers in the Marine Corps are smart enough to listen to their sergeants and not have this attitude like, talk to him and he'll tell me, it's none of that.
Yeah.
They really listen to the middle. And the
Hmm.
the leadership works with the middle in terms of organization, and moving things forward. And I find that, like, if you've been a nurse for
Mhm.
3 years or 4 years, maybe you didn't get that extra certification, you haven't got your master's yet. It doesn't matter. You have an expertise and an experience, and you have the leadership quality in you because, especially if that's
Yeah,
something that you want, you have it. You don't need,
yeah,
it'd be great, you go back to school, you sign up for that class or take that course, but
yeah,
believe in yourself because you need nurses. We need to start believing more in the expertise that we've
yes,
cultivated rather than
absolutely,
saying, well, I
absolutely.
have to go back to school first. It's like, no, you don't. You could start speaking up now and start showing initiative and taking on more responsibility now.
Hmm.
It's not about how stacking the credentials.
No, totally agree. Totally agree. I mean, like, when you're taking care of that patient in the hospital bed, I mean, they're not going to be asking you if you have your DNP or master's. I'm like, you
And I'm
have the
and I'm not
RN, you have
selling that short
the
either. It shows a level of commitment to go for
yeah,
that and to do that. Sometimes people might feel a little inferior next to
yeah,
somebody like that and might not
yeah.
speak up. Or like you're talking about the power of nurses. I was on the podcast. I had a nurse expert witness, so she
Uh-huh.
knew the whole legal side for
Hmm.
testifying as a nurse.
Hmm.
And one
Hmm.
of one of our legal responsibilities is before we administer any medication or initiate a treatment plan that comes from a physician, we have to know if it's safe for the patient. So
Hmm.
as a nurse, you're not just you're fulfilling your role in patient care. You're actually supposed to ensure that the entire treatment plan is safe for the patient, even if it
Oh,
comes
yes.
from an upstairs, some order from an admitting doctor. They make an order. You're not certified to make that order. You're not supposed to be qualified to make that order, but you're expected to know if that order is safe for the patient. I mean, that is an astounding power and responsibility. Whatever touches that patient, because you can't say, well, the doctor made the order.
Yeah,
Yeah, they were on a non-rebreather, and he said to take them to CAT scan.
yeah,
Well, non-rebreather is not a treatment plan. Are they able
yeah.
to? Are they stabilized? You're supposed to know
Hmm.
if that
Hmm.
medication was given at that dosage strength. Yeah, of
Yeah.
course, it comes from the doctor, but you're supposed to know if it's safe.
Oh, yeah.
That's an amazing responsibility.
Think about it from the floor perspective when you're questioning a doctor's order. It's like, because you are responsible for all of that. So, you're obligated to question something if it doesn't seem right, if it seems like it's going to cause harm. So, we have these skills, like we can question the status quo. We can do all that. We need permission. I think some nurses feel like, oh, we need permission to do
Yeah.
these things. No, we don't need permission. And so my concern is really like the younger generation of nurses because we want them to stay in the nursing profession for a long time. Because I mean, like I need them when I get older and
Yeah.
end up in the hospital. I need them to be there. So, how can we make them feel like they're empowered, they're valued, that they're going to be taken care of? And I think that's our responsibility as this current generation of nurses to make sure that we're taking care of the people coming into the profession. So, again, too, that
And
ties
part of
into,
that is, not being caustic or sounding cynical
yeah,
but to be realistic about what they're coming into.
yeah,
There is a big dropout rate. We won't get into it, but it is a unfortunate number of people who don't continue in the profession.
yeah,
And maybe a lot of people think that nursing, I was a great babysitter, so I thought I'd be a great nurse. And it's like, well, that is not the profession. Nurses, for example, I don't have the number, but they get assaulted more than police officers.
yeah,
Um,
yeah,
this can be a rough profession at times. It could be a very rewarding profession at times, but I think there should be a realistic photo or picture
yeah,
presented to
yeah,
students. And I do like what's happening lately with the preceptor uh, new nurse relationship. At least here in New York, you'll get someone at a nursing school who will be working with somebody. They could be working with another nurse up to like 6 months. There is
mhm,
they do cultivate the new graduates a little bit more,
Yeah, which
because
is
it
good.
is. I don't know how they're doing it in California, but I've seen it a lot more now. You're not going right to work.
Yeah, yeah,
They are gonna
which is
teach you. You know,
good. Yeah, when I started, I mean, they threw me right into it, and it was
yeah, me
like,
too.
gosh, it was scary, and and again, that goes into nursing research. So I mean, a lot of people don't know that there's nurses that do like these research studies and all that. So they're finding the best ways to keep nurses in the profession as you train them up. But who's gonna want to do a study like that if you're not in nursing, right? So we're also the best that can find data for our profession, like because we live this experience so that we can keep the younger generations of nurses powered up and keep going. Yeah, keep doing what you're doing because I think just educating the public on what nursing does is one thing, but like I mean educating the public on the number of male nurses there are, right? Because I think a lot
Well, that's a
of
whole
like
different story.
how many times do you get called a doctor
You
probably
mean
just
that
because
I
just
should have a
because
different
you're
title of everyone's nice to the male nurse because everyone's going to need somebody lifted up or pulled
yeah,
up in bed or held down or
yeah,
in Queens on occasion that violent patient in the middle of the night. So
yeah.
we had in that Queens hospital there was on the overhead security, but then when like there just were not enough people, you'd hear manpower, manpower, which is like basically, you know, the nearest male nurse, please get over here. Yeah.
Yeah, yeah,
So
yeah.
I
So
don't
I
mind being the
mean,
caveman. Being a caveman is what differentiates me and gives me any kind of advantage. I'll take it.
yeah.
But I want to thank you officially, Jelani, citizen
Oh, thank
nurse.
you too.
I
Yeah,
uh, I really
appreciate
love
it.
your channel. It's great. I love what you do. You inspired me. As soon as I saw you online, I'm like, I hope she wants to talk to me because
Oh yeah, yeah.
this would be a
I'm the
fascinating
same.
conversation.
I love to talk to nurses and if you don't mind, I mean, there's some nurses that I've been on podcasts with and stuff. If you don't mind, I might connect you with them just because I think you have a great message as well. So
Oh, I
I'd be
love it.
happy
I
to do
love
that.
it. Yeah,
Yeah.
it's all about patience. It's all about spreading the information and the wealth of knowledge. Because, and I'll end it at this. I was doing a clinical. I was at a. I thought you disappeared for a second.
Oh no, I'm here.
There's one thing because I remember I was in a clinical. I was at a rehabilitation center, and somebody who was a former addict. He said, "You don't keep anything you don't give away." And that's knowledge. If you can't hoard knowledge, if you do, you haven't learned anything. And I feel like by teaching, you're only cementing what you know, and you're also hearing other opinions and shaping what you know, and kind of you're advancing.
Yeah,
All
it's
right.
about sharing the knowledge. So
Well,
all
you're in
right.
California. You got the whole rest of the night ahead of you. I'm like, it's almost bedtime over here.
Oh,
So
that's right.
you enjoy
All right.
the rest of your evening, and
All
thank
right.
you so much for doing this.
Of course, and Happy New Year to you. Take
Yeah,
care.
Happy New Year. Take care.
Okay.
Well, the sun seems to have finally been blocked by a cloud in my makeshift studio, but that's okay because, in my opinion, the interview you just saw had all the sunlight you need. Two nurses, East Coast and West Coast, coming together to present to you elements of our personal experiences presented in a conversation that strive to be as objective as possible. What can I say? I'm an 80s and 90s kid. It's what we do. If you like this episode and you like what I do, please like, share, and subscribe and comment. It makes a big difference with the algorithm. Until next time, Nurse Dad out.